CanCOVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Hello, everyone, and welcome to CanCOVID Speaker Series. Thank you all for joining us. I'm delighted to welcome Dr. Angela Mashford-Pringle, who will be presenting to us on what we heard, Indigenous Peoples and COVID-19. Dr. Mashford-Pringle is a professor at the University of Toronto's Dalla School of Public Health. So before we get started, there's just a few items that we note. All audios and videos are disabled for participants, but we do welcome you to ask a question or say a remark in our chat box below. We also want to note that this session will be recorded and posted on CanCOVID's YouTube channel. So actually, we'll hand over the floor to Dr. Mashford-Pringle, and hope you guys enjoy this session.
Good afternoon, Queque. I'm Angela Mashford-Pringle. I'm from Témiscamingue First Nation in Northern Quebec, but I was born and raised here in Toronto. I had the distinct pleasure of connecting with Indigenous people across Canada back in September of 2020 around COVID. And I'll get to that in a minute, but I really wanted to start us off and talk a little bit about our world today and reflect on what's going on currently in Indigenous people's lives. So many of you have heard about the 215 children that they've found at the Kamloops residential school. There's been another 139 found between Brandon, Manitoba, and two schools in Saskatchewan. And today, the Ford government in Ontario has also announced that they're going to put $10 million towards locating the rest of the children at our residential schools here in Ontario. And the reason I bring this up is we, as Indigenous people, have known about these mass graves long before now. We also know that there's likely mass graves at all of the Indian hospitals and sanatoriums that were across Canada. That inter and intra-generational trauma also impacted the way people spoke to us when we talked to them about COVID back in September. And I just want to put that out there for you to reflect on, and how this report reflects on what Indigenous people across the country said. We also had a very tight timeline to do this in, and we did our best to try to represent Inuit, Métis, and First Nations communities across Canada when we were holding our sessions for the Public Health Agency of Canada. And as many of you probably were very busy at the beginning of COVID, I started out, before I did this report, I was working with Anishinaabe Nation in Northern Ontario so that they would have protocols for child welfare. So when everybody was locking in, and it seems relatively easy back in March and April of 2020, it wasn't easy for the fly-in communities in Northern Ontario. If you had any child welfare issues, it was hard for social workers to navigate, because they completely locked down those communities and there was no air traffic, so you couldn't get into the communities. So they had to have child welfare protocols that reflected what COVID was doing in their communities. And I know from talking to them then, there was fear of having people from the outside. So when you start to look at the Public Health Agency of Canada report, that's one of the first things that we talked about. One of the key themes that came from talking to the Indigenous people was around the idea that when shutdowns were happening, the Prime Minister didn't talk to First Nations communities that are at the borders. So, in the Vancouver area, down in the Kingston, Cornwall area of Ontario, and the Montreal area, we have First Nations who are very close to the border, who were not communicated with. There was a lot of discussion about reopening the US border, but none of that discussion was happening with those First Nations. And they were very upset by that, because they didn't know what was going on, nor was their leadership being talked to about what that was going to mean for them. Then when we opened back up in June and July of last year, some of the First Nations, specifically in Ontario, were saying that people from the Toronto area, which was a hot zone and has just recently not been the biggest hot zone, were going up and going into the cottage country and going right on to the communities. Even though they had blockades at the end of the roads, people were going in by boat, and they were just walking around community like it was nobody's business, and everything was open and they could do whatever they wanted. So this was problematic. That's a lack of Indigenous sovereignty, and we heard that clearly from the communities, that they didn't have a say in how COVID played out in their communities. It was all done at higher levels. Still seems to be that way. If you take a look at the most recent outbreaks, they shouldn't have happened if people were following the public health guidelines. And some of the communities have said, even now, that it's about having the ability to say no and say who comes into community. And that clearly hasn't been happening in every community across Canada. So with that being said, a lot of the people that were part of this 2 calls that we had were saying that Indigenous people should have a seat at the table. And we've heard this before in many, many reports that the Government of Canada has sponsored or commissioned. And this time they were adamant. We had a Canada pandemic influenza plan. We have provincial ones as well. It didn't seem like anybody was following those plans. And so part of those plans talked about how communication should have been with Indigenous communities, and it clearly wasn't happening. So I think as we go forward, one of the learnings that we talked about in the calls was that the federal government has to ensure that the communication lines are open and that they're talking to various levels of Indigenous governance, not just the Assembly of First Nations or not just the regional chiefs tables, but actually to specific First Nations as things pertain to them. We heard a lot of great strengths-based information about kinship. There was a number of communities who, as soon as the pandemic happened, took it upon themselves to find ways to ensure that everybody was getting food, because in flying communities, it was kind of hard to get any of the food. They also didn't have proper PPE at the beginning. So, the discussion around how do you ensure that the seniors and elders in communities were safe was one that they had locally. In some communities, they sent everybody out on the land, and in other communities, they would have people who created meals, and they were sent out to each of the homes for the elders. The other thing is we found that youth were facilitating discussions because they were feeling, the abrupt change in their curriculum. They were feeling left out. There was a lot of mental health issues, which I'll talk about in a minute. But this was something that was of great concern for our communities. And food security hasn't actually stopped being a concern. It's still a concern now, even though this report is coming up to its half year, I guess. So again, it's something that we need to look at in how we supply First Nations with food. We found that a lot of people were talking about how traditions came up. So for a lot of Indigenous people, wintertime is storytelling time, but because of COVID, they started doing storytelling in the middle of summer, which was unusual, but it was the only way we could stay connected as Indigenous people. And then we had social media, which was helpful for some First Nations people and Métis and Inuit communities, where they were having virtual powwows or virtual talking circles or virtual teachings. And then there was, the younger generation was having something called Pass the Brush. I'm not sure if everybody's aware of what that is, but you go on and you kind of go to your camera, and then the next thing you see people transformed into their regalia. So there was those kinds of things going on. We did follow physical distancing as best as we could. in most communities, but we already have a problem with overcrowded housing. And so this was problematic. Part of what I learned when I worked with Anishinaabe-Aski Nation was we also didn't have extra buildings to put anybody to quarantine. So unlike it being in a city or even a rural area, there's no cabins or hotels that you can stick people to quarantine. So this is something that needs to be discussed as we move forward past COVID. How can we deal with that? What would that look like? And where are we going to go with that? So mental health, the one thing that we did see a little bit of was there was money put into mental health for First Nations, Métis, and Inuit communities. However, people were still saying that there wasn't a lot available. And if you didn't have either broadband internet access, or some way to talk to a mental health professional, that it was actually worse in this situation because nobody could come into community to help. A lot of the communities started creating like peer kind of groups or ways to talk to each other to make it through. And much like I was saying at the beginning, the historical trauma that we knew as Indigenous people that has happened for 150 plus years was coming to a surface because, yet again, like the past system, and if you haven't learned about that, you might want to, we weren't allowed to leave our communities. And so this was problematic because it made us feel much like we did during the past system. We did have issues with substance abuse and substance misuse. This was happening in various communities at different levels. But again, communities were trying to be resilient and they were trying to find ways to deal with the substance use issues that were happening. We did notice an increase in opioid overdoses during the time and an increase in suicides. When you look at it in the bigger picture, it seems like a small percentage for Canada, but it's a large percentage when you're in small community. I really strongly want to commend First Nations, Métis, and Inuit communities because their leadership stood up and took the lead, even when they weren't getting direction from either the provincial or territorial or federal level, and they decided on what needed to happen. And they learned from H1N1 and smallpox and the first SARS, what they could do and what they needed to do. And so they did that. And there was a knowledge exchange amongst different Indigenous communities that was very helpful because then you could say, hey, this was working for us. Do you want to try it? We also had a lot of the COVID messaging translated into various First Nations, Métis, and Inuit languages, and they were posted so that it wasn't all in English and French, and that wasn't a priority for many of the governments. They weren't even thinking about that, but we had that done for our own communities. We made sure that PPE was argued for and received. Sounds kind of trite now, but I remember talking to people and it took like 4 months for them to get masks into communities. And even then, there wasn't enough. So you were reusing disposable masks because there just wasn't enough of them there in order for you to continually change them. As you probably have heard, there was mistrust. And we talked about this before the case of Joyce Echequan in Quebec. She passed away while Facebook living racist attack on her in the hospital. But we already talked about that during this, and this was in August, September, so pre her death. And I what I heard a lot of was Indigenous communities were kind of worried about being the guinea pigs for the vaccines, and they were worried about what happens when people need ventilators or need to be hospitalized in an ICU, because a lot of our communities are flying in. So they were worried about how they were going to get to that kind of resource. We know that there's structural inequalities for Indigenous people. Broadband access doesn't exist for a lot of the northern communities. This was brought up by many of the participants. They were talking about the fact that they couldn't do So while we were having things all online in the south of Canada, they couldn't talk to doctors or nurses or get the services they needed because they just couldn't stream it. They didn't have the bandwidth. And this is going to be something that needs to be changed like rather quickly. There was also the issue about trying to do schoolwork and have people working in the same house when you already have low bandwidth and what that looks like. So this is something else that we need to, as a country, think about. What does that look like? Housing, like I said before, we have overcrowded housing. A lot of our houses also have black mold and other issues. And so there's not enough room for people to physically distance within a house. So even if somebody got sick, there was nowhere for them to go. Water is another huge issue. We were telling people to wash their hands. And in some communities, they have contaminated water. So telling them to wash their hands in contaminated water was like, oh, yeah, well, they can still do it. They can, but then you're going to end up with other health issues. We need to have clean water in community. We've known this for a long period of time, but nothing has changed. Testing didn't come up into communities until later in June, July. So they weren't able to get tested. So they didn't know if anybody was asymptomatic in their communities. This was a problem. The accessibility to healthcare was also a problem because, again, we didn't have broadband and there were, not a lot of people were doing phone. They wanted to do Zoom. And a lot of the healthcare that they were getting was culturally unsafe. So they felt like they weren't being heard by the healthcare professionals. So this is something else that we now have to start dealing with. I know that it started before COVID, but it really needs to be delved into. Funding is a huge issue. How much funding was put towards First Nations, Métis, and Inuit people versus the Canadian population, and the difference in disparities already there just made it that much worse. We did notice that there were a lot of participants talked about their connection to land, and in fact, in the Northwest Territories, the government, the territorial governments were working with the First Nations governments to pay people to go out on the land, which would get them physically distanced from each other and away from the COVID threat. And it did work for the most part. Ceremonies had been put on hold. There's a lot of discussion about how do we move back into ceremonies. I'm doing a research project on that right now. And some people are willing to take the risk because they want to be in ceremony, and others are not so happy with having to do that. There is a lot of talk about communication in the report because communication was all over the map from the beginning till now. The messaging keeps changing. And it's not just the messaging changing because we've learned something, but you would have federal government say something and then you would have the provincial government say something else. So there's really this idea that we have to have more consistent communication. So we had some recommendations that we gave to the Public Health Agency of Canada. If you read the report, I know that the link is in the chat if you want to take a look at it. One of the big things that we really pushed for was that we needed to have better communications, for one. The way things were being told to First Nations. So what Canadians heard was, we're going to be giving $56 million to Indigenous communities for COVID, when in fact they had to compete for it. And it opened on the Thursday of the Easter long weekend and it closed on the Sunday. So I realized we were in COVID and nobody was going anywhere, but that meant people had to work over that weekend to put the grant together to get money into the community. And that shouldn't happen. We had other people who were saying that the amount of funding they were going to receive, if you divided it up against all the Indigenous communities, wouldn't have been enough to do anything. So these are kinds of the big key things. And I think the biggest key for me was, we have to, as a country, start thinking about cultural safety. So, most people are at least culturally aware at this point. You're aware that there's other cultures. Some people are at the point of being at least culturally competent, where you're trying your best to acknowledge your own culture and other people's cultures. but we need to get to cultural safety. And this really means that we have to look at our own power, privilege, and positionality, because what's happening in healthcare, what's happening in our world in terms of water and other issues is extremely disturbing. And, the finding of, more than 300 Indigenous children in unmarked graves tells you that this is not over, and we have a lot to start to unpack and discuss. And COVID has just brought all of this to the surface for us to discuss. So I'm going to leave it there and open it up for questions. I know I kind of went fast, but you have the chance, if you want to read the report, and then we can also talk at some point in the future.
Thanks. Thank you so much, Dr. Mashford-Pringle. So we are in the Q&A session. We have about 8 minutes, everyone. So just take your time to ask any questions in the chat box, and I'll be happy to relay them. So we do have one. So the question is, how do we ensure that we are providing support to First Nation communities that is respectful and cognizant of cultural varieties that exist between different Indigenous communities across Canada?
Talk to the community that you're working with. That's the first and foremost thing I can tell you. They're going to tell you what their protocols are. They're going to tell you what they need, and take cultural safety training. There's some available. Mine's not there yet. I am creating one. But there's already things that you can do, and just learning, just spending, a few minutes to learn a little bit about the communities you're talking about. So wherever they are, finding out about the treaty, finding out about, what concerns they may have and how they self-identify. That would be the first thing to do.
Thank you. And the next question is, what can be done to address the community concerns about vaccines?
Well, I think we've had a pretty good uptake in most First Nations communities. I don't know about the Inuit or the Métis. I haven't looked at the statistics for it, but you've got to remember, we got blankets laden with smallpox. We've had experiments conducted on us in residential schools and the Indian hospitals. There's going to be vaccine hesitancy because of our mistrust for the healthcare system. It's going to be you working with a community. It has to be a reciprocal relationship.
Thank you so much. So we'll probably get a few questions coming in just a few moments. Oh, we have one here. Are there examples of culturally competent virtual care that we need to learn from and expand? Good question.
I just worked with the Toronto Central LIN, if anybody knows what that is. I was running the Indigenous community lead. So we pulled together resources on how to do community engagement, how to do Indigenous data sovereignty, how to do cultural safety, how to put in Indigenous patient navigators, how to make mobile crisis units, how to find cultural safety. So it's not live yet, but it will be a website. So there is going to be a place that you can go find all of these things in one spot. And hopefully it will be soon. I believe they're just starting with the early adopters in the Toronto area. So we're hoping by September we'll be able to open it more live to everybody, but you need to look at the communities that you work with.
Thank you so much. So the next one is, where do you recommend getting firm statistics regarding the impacts of COVID-19 pandemic on the Indigenous communities?
What kind of, I would ask, what kind of statistics are you looking for? Because the communities themselves have a lot of statistics. They haven't been released to the public per se, but then again, the reason statistics aren't usually released to the public is because they're misportrayed. So they're always deficit-based, and nobody wants to talk about the more strengths-based approach.
Okay. The next one is, have there been any concerns expressed specifically about children's health and learning considering school closures and online learning?
No, That was not a concern that I heard from any of the participants. Some of the participants were saying it was the first time that they could go back to cultural teachings. So they were actually, in some places, very happy that the students didn't have to learn online and that they could actually start to teach their language and their culture to the children in the community again, without having the interference of Western education systems.
Okay, and the next question is, any key challenges or noteworthy findings for urban Indigenous peoples in particular? There seems to be quite a vacuum on data for this population.
I think part of the reason there's a vacuum is because there's so many different organizations across Canada doing urban Indigenous health that they're not necessarily all colliding. So like in Toronto, I believe Anishinaabe Health Toronto is working with all of the other partners to collect all of our statistics. I think you will hear more about those statistics over time. We only have one Indigenous epidemiologist that I'm aware of in Canada. She's working her butt off, but she can't be everything to everybody right now. I know she's been doing her best to do that, and I hope that we'll have more statistics as time rolls on. But it's really hard to get those statistics because urban Indigenous people don't necessarily self-identify. They may not be status First Nations people, and they may not have any direct connection to any of the Indigenous organizations.
The next question we have here is, how do you carry out participatory research or service delivery on a short period of timeline, such as in a pandemic? Is it about having done work ahead of time to build relationships?
Oh, yes. And we talked about that in the Public Health Agency of Canada report. You need to have true and authentic relationships with First Nations, Métis, and Inuit communities. That means reciprocal relationships. It doesn't mean you come in and say, here's an email, now we're friends, we're going to work together. There actually has to be relationship building, and it should take time to do that. It's not a one email, one phone call kind of deal. You need to take the time to get to know the communities. Otherwise, you're just perpetrating more colonialism on our communities.
I just realized I'm on mute. Sorry. Story of our lives over the past year and a bit. So the next question is, what are some inspiring examples of strength-based approaches that have helped communities?
They have loved having their own online teaching platforms, their own online powwows for some communities. Those are strengths-based. Reaching out to the land again and being connected to land in various ways, totally important, as well as being able to connect to their family. This is the first time any of us has been able to be with our family more than a few hours a day. We can actually be with them longer periods of time. And I heard from many of the participants, this was very, very important to them.
Okay, great. Not a question we have there, but I found the following resource to be very helpful or useful to get better understanding of cultural safety. So everyone, for your information, there's a link there if you'd like to look that up. So anyways, we're gonna end this session here, but I just wanna take the opportunity on behalf of the CanCOVID team and network. We would like to thank you for your time to present to us on this extremely important topic, and I've learned so much today, so thanks so much. And the report link is there if anyone hasn't read that yet. I think, Angela, you said that we can ask further questions if we have any.
Yes.
Thanks so much. And just a few announcements before we end the session. Please join us for our next speaker series, which will be held next Tuesday, June 21st at 4 p.m. Eastern, to hear from Robert Strang from, he's the Chief Medical Officer of Health in Nova Scotia, on the lessons from Nova Scotia and Atlantic provinces during the pandemic. So thanks everyone. And thanks again, Dr. Mashford-Pringle, for your time today to present to us. Have a great rest of your day.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CanCOVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.